Hey everyone, Dr. Luke Pedersen here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about the use of antibiotics for dental procedures after having knee replacement surgery. So this topic has become controversial over the last number of years. So the traditional thought is after having knee replacement surgery, your surgeon, traditionally speaking, would recommend the use of antibiotics prophylactically, so prior to or before any type of significant dental procedures or dental work. And the thought process for this was that with dental work and dental procedures, this causes bleeding in the gums and in the mouth, and it can cause bacteria to get into the bloodstream. And that bacteria can then travel through your bloodstream to your knee and kind of colonize itself in and around your prosthetic, and the metal components of your prosthesis can be really vulnerable to bacteria and the growth of bacteria. And what this leads to then, of course, is an infection of your knee joint, which can lead to a lot of issues, of course, and most notably the need for a revision knee replacement surgery. So obviously a very significant thing that we want to avoid as much as we possibly can. But however, what they found is now there's been a lot of different research articles out there that study this, and they compare individuals who have had a knee replacement or a joint replacement and had a subsequent infection of their joint, and they compared them to individuals who've had a knee replacement or a joint replacement and didn't end up having an infection. And they looked at the different exposures and the different risks and different things, and they found that there was really no correlation or no increased risk from individuals who had dental procedures, who had dental work, and there's no increased risk of infection for individuals who didn't take antibiotics before having dental work or dental procedures. And this has been for a handful of different studies that have looked at this, and they've really showed that there's no increased risk. Now, there is, of course, the risk with dental work of getting bacteria into your bloodstream, but this is something that can happen just with normal daily activities, such as brushing your teeth a little too hard, or if you're chewing on something a little bit too much and it causes some bleeding in the mouth or the gums. So just because there's bacteria in the bloodstream, though, doesn't necessarily mean, or oftentimes doesn't mean, that you're going to get an infection of your knee replacement or of your joint, or it doesn't increase the risk by any means necessarily. And so a lot of different associations, both on the orthopedic surgeon end and in the dentist end, have now come out with a lot of recommendations that their recommendation is for the vast majority of people after having joint replacement surgery, it's still not necessary to have antibiotics prophylactically after surgery. Now, there are some subsets of people where having those antibiotics still is prudent and still makes sense. For example, if you're someone who has a history of joint infection, if you're someone who may be immunocompromised, so if you have, for example, rheumatoid arthritis or diabetes or chronic kidney disease, or maybe you have a history of urinary tract infections, then for you and some other different circumstances, it may be appropriate still. But for the majority of people, it's kind of an unnecessary step to take these antibiotics prophylactically. And there are some risks, some small risks. There's no risks of significant adverse events from taking antibiotics, and they're relatively inexpensive. But there is something that we want to be concerned about, and that is taking too many antibiotics can lead to what we call antibiotic resistance. So the more that people take antibiotics and the more that we overuse antibiotics, this can lead to some resistance, and it may cause, if maybe sometime down the line where you really do need antibiotics, that they may not be as effective because some of the bacteria within your system has started to develop some resistance to that bacteria. And also, antibiotics are really not discriminatory. So what that means is they can kill both the bad bacteria and the good bacteria. And there's a lot of good bacteria in your body and in your systems, such, most notably in your gut and your intestine and colon, that are really helpful and really useful for a lot of different things. So we don't necessarily want to wipe those out by taking antibiotics every time you go to the dentist. Now, there's probably going to be some surgeons out there and some dentists out there that disagree with me, and I would say absolutely listen to your surgeon and your doctor and your dentist, and whatever they tell you is, what you should do. But just, think things over a little bit and understand that there is some controversy to this topic. There are some different recommendations out there, and if you actually look at the statements from a lot of these very significant and very big associations, both for surgeons and dentists, they don't recommend prophylactic antibiotics for all dental procedures. So your surgeon might fall somewhere in between. They might say just early on, or they might be someone still who says for life they think you should take antibiotics. But the research and the recommendations from, again, these very notable associations doesn't necessarily add up with that recommendation. Thank you very much for watching. I'd love to hear any questions you might have, so please be sure to leave those in the comments. Please be sure to turn on your subscriptions and hit the notifications so you can catch all of our videos related to knee replacement surgery, exercises, rehab, frequently asked questions, and everything else. Thank you very much for watching.